Sure, thank you. No. I've survived.
All right, I'd like to call this emergency meeting of the St. Charles County Council to order here on March the 20th, 2020. We'll start off with a roll call, and then Mr. Watson has some comments to be made to start.
All right, roll call, Councilmember Joe Cronin, Councilmember Joe Brazel, Councilmember Joe Brazel,
Joe, we're taking roll. Can you hear us?
I can.
Joe, can you hear us?
Councilmember Mike Elam.
Here.
Councilmember Dave Hammond.
Here.
Councilmember Terry Hollander.
Here.
Councilmember Nancy Schneider. Here. Councilmember John White.
Here by phone.
Okay, we will.
Get him on the phone.
We're working on it.
They had him and he dropped off, so they're trying to get him back. Are you calling him my cell or you want me to?
I am doing
Donna's
it.
doing it.
In Illinois?
Okay, Joe, you've dropped off the pod phone, so we're going to have you live through my cell phone. Are you present and accounted for?
Is he on speaker?
Will be if she puts it on there, but the phone is on speaker.
Okay.
Who's in the room?
Go ahead.
The council is here,
Minus Joe Cronin.
minus Joe Cronin.
Well, Cronin was denied access. I don't understand why Belleville or Southern Illinois in a rural and Cronin goes to his farm. That's safer than where you folks are. And he was denied access, really? I mean, how come when Joe Cronin and myself wanted a substitute bill, we're the ones denied access because I was in Belleville on Tuesday, which is the metropolitan area? Are we really doing that? Which we never got our substitute bill. I guess, is there nobody responding now or what?
They hear you, Joe.
Joe, we're gonna start off with the statement here by Mr. Watson, kind of explaining the situation and where we're at right now.
Make sure they talk louder because it's like you're just barely here, Terry.
Okay, thank you, John.
Thank you, Mr. Chairman and members of the County Council. First of all, thank you so much for gathering in these unique circumstances. For purposes of the record, I'd like to put in the minutes that the basis of the emergency is, as declared by the county executive, was the health pandemic, and we will be operating under, for purposes of receiving communication and comment from the public. We will be operating by allowing them to submit public comments through electronic and written communications until noon today, and those public comments will be included in the record of this meeting. For purposes of ensuring that the public is aware of what ordinances we're dealing with, those will be also put on the screen, and we will go through those. As we go through those, the full ordinance will be shown on the screen. It's also available on the county's website as well for anybody that would like to review it. With that, are there any other questions?
Are there any questions for Mr. Watson? Okay, seeing none, we will proceed with emergency bill number 4828.
Emergency Bill Number 4828, requested by Demetrius Chancey Chapman, sponsored by Terry Hollander, An emergency ordinance authorizing the county executive to execute an agreement with the City of St. Peters to obtain space in the St. Peters Emergency Operations Area for the purpose of operating an informational call center to respond to citizens' inquiries regarding the COVID-19 pandemic.
Is there any questions or comments on this particular bill? Okay, seeing none, we will call the roll.
Emergency Bill Number 4828, an emergency ordinance authorizing the county executive to execute an agreement with the City of St. Peters to obtain space in the St. Peters Emergency Operations Area for the purpose of operating an informational call center to respond to citizens' inquiries regarding the COVID-19 pandemic. Councilmember Cronin, Councilmember Brazel, Councilmember Elam,
Yes.
Councilmember Hammond,
Yes.
Councilmember Hollander,
Yes.
Councilmember Schneider,
Yes.
Councilmember White.
Yes.
Okay. Emergency Bill Number 4828 passes. Next up would be Emergency Bill Number 4829.
Emergency Bill Number 4829, requested by Steve Ellman, Demetrius Chauncey Chapman, sponsored by Terry Hollander. An emergency health ordinance with a penalty provision and enacting a new section 210.005 of the ordinances of St. Charles County, Missouri, relating to failure to comply with public health emergency orders.
Questions or comments on Bill Number 4829?
I have some questions and comments.
Mr. Elam.
So I would like to have, can Joe hear? I don't know. If you want to hand me the phone, I can hold it and we can pass it around if you want. I know Councilman Brazel and Councilman Cronin both were talking about doing a substitute bill on this. Joe, did you guys get anywhere on your substitute bill?
Well, we submitted it, but no one did anything with it. We wanted it. We had a couple questions on what the penalties were, and we had some questions on. Joe was denied access into the building, like I said earlier, as I was too, because I was in Belleville on Tuesday and Joe was in his rural farm. I don't quite understand what is considered. I know they say state lines, but I mean, going to a farm in rural Illinois is a lot less dangerous than where you guys are. But Mike, we submitted. Joe Cronin submitted it, but nothing happened with it. So, I can't speak for him because I co-sponsored it with him and he wrote it. So I don't know. I just don't know why it was completely rejected. Maybe it wasn't a good plan at all. But the whole point is we still have to have conversation. I mean, we can't just we can't have the cure be worse than the disease by just ignoring people's thoughts and conversations. I'm not saying that's particularly happened because I know the folks in that room are more into the trenches than we are. But I just think there should let's not lose our level of respect for each other. But I don't know, Mike. Go ahead.
So I don't know what the changes were that you and Mr. Cronin were talking about enacting here, but some of the questions that I have is it says that we have a penalty, but I'm unclear on what the penalty would be. So I'd like some clarification, first of all, on what that would be. Secondly, I'm uncomfortable with the fact that the way I read this, and I would prefer some clarity on this as well, but the way I read this is if we approve this the way it is, the council basically does not get a voice in these decisions that our new director of health, and you may be an awesome dude, but I don't know you. So I don't know where you are on this stuff, and the county executive can make these calls without the council weighing in at all. I'm uncomfortable with that, and I'm uncomfortable with giving up our rights as elected officials and being able to weigh in on this. And I think it's pretty clear you can get 4 of us to a meeting, as shown today, even with the restrictions that we're working under. And I think it's well within reason to run these things by the council to get that done. But Mr. Watson's here at the podium to add some clarification, I'm assuming.
Hey, Mike, if I may add, everything you said was exactly what Cronin and I was in our substitute bill. We suggest that maybe it's put on a 30-day sunshine or something like that, whatever reasonable, and because there's no expiration date to this, and I don't believe there is, and all these ordinances should have an expiration date, all of them. And it should be council approval. You're absolutely right. That is absolutely correct, and that's how I'll support this bill.
So, Mr. Watson, Don, if you want to hand this over to John so they can hear.
Mr. Chairman, with your permission, I'd like Amanda Jennings to come up. She handles the lion's share of our office's prosecutions of municipal ordinances, and give her the opportunity to walk through how the penalty provision of this would apply, and that'll be her focus.
Thank you.
Thank you.
We appreciate it.
Watson, but before you do that, may I speak to something first?
Yes.
Yes.
So, what this bill is doing is actually trying to provide some sort of misdemeanor criminal fine. But just so you know, speaking to your points directly, the ability to declare an emergency in this state for each jurisdiction belongs to the chief executive order by Missouri law. Belongs to the governor, belongs to the county executive, belongs to mayors. By state case law, when it is a public emergency, we have the ability to declare it, regardless of being a charter county, for the cities within this county. In addition to that, there is some state law in Chapter 44 about public emergencies. And from that, the state has created a regulation, pardon me, that was just dry mouth, sorry, that the Director of Public Health is the lone authority to be able to declare a public emergency order to prevent the spread of contagion. So what you do here, you can say this won't be a criminal event, and Amanda will explain that to you, but you cannot change those authorities by ordinance.
Okay.
Joanne, am I correct in also assuming that Mr. Elam talked about how long this would remain in effect? It would remain in effect during the duration of the emergency order and would terminate upon the expiration or the cancellation of that order. Am I
That is correct. That is correct.
But, so point of clarification, does that mean if we approve this the way it's written, anytime in the future that there is an emergency declaration, this would go into effect? And so let's say Mr. Ellman is no longer the county executive and we have a new county executive. If we approve this, is this approved power now for every county executive to follow in the history of the county or in the future of the county, as long as there is an emergency declaration done?
You mean the penalties?
I mean, yes.
Yeah.
I mean, if we pass this, does it go forever as long as anytime a emergency declaration is made, does this go into an effect?
Okay. Mr. Watson?
Well, it would, but you can, when the emergency's over.
Can you lean into that, Steve?
No. My
emergency
emergency
is over,
order,
you
you put time to get.
the order.
I think a lot of your concerns might be addressed when you find out kind of the technicalities here with regard to why we're doing this, because there's already a state statute. Pardon me?
John can't hear.
Can you hear now, Joe?
John.
John, can you hear?
I can hear, but it's not a very good quality.
Terrible.
I'm gonna try to watch it on another phone.
Mr. Chairman,
Hello?
Yes, we're here.
How much do we spend on communications?
Okay, proceed, it's okay.
You can hear now, Mr. White?
Yes.
Yeah.
All right.
Okay. We were going to hear from Ms. Jennings.
Mr. Chairman, I want to relay, I could hear, and I don't believe the rest of the room could, something Mr. Councilman Brazel urged the council to consider, which was to put a sunshine date or an end date to the ordinance. Joe, I think Councilman Brazel, that is what you were communicating?
Yes, sir.
Okay.
That's correct.
Okay.
Thank you.
Thank you, Joe.
Good morning, council members. So to go to your question, Councilman Elam, this would fall under the general penalty clause for St. Charles County. That's within our ordinances. So the penalty for this would be up to a $1,000 fine and up to a year in jail. It would fall, I guess, under the state statute that is very similar to this is a Class A misdemeanor. The state can get a little more fine money for it, $2,000. The county is limited to $1,000.
Okay.
And I just want to say, this is a tool that the county can use to help the safety and welfare of this county. It's just a tool in the pocket of the municipal court, of the police officers to deter people from violating and making things much worse. So I just want you guys to know, I want you to have faith in our municipal court, in our prosecutors, and in our judge. You know, you help select the judge, and he's not going to throw anyone in jail for a year because they, you know, were in a group of 11 people. You have a great staff. There's common sense that goes along with this, but I would just hope that you would allow the court to have this tool to deter any type of behavior that is dangerous.
Just one other, I think, relevant factor is that under state law, obviously, Prosecutor Lomar could prosecute those cases as well. What we are trying to do is coordinate these kinds of issues in this ordinance, and we would handle it through the county counselor's office, and that was with discussions with the prosecutor. But the prosecutor could also charge these offenses as well under state law.
And there is prosecutorial discretion. And also the judge who presides over the matter has discretion as well to take into consideration all of the circumstances. And so, I mean, that's just like any other case.
And I'm sorry, Councilman Brazel.
Hey, Donna.
Can you hold him up to the microphone, Amanda? Yeah. Thanks. Sorry.
Donna.
Yes, Joe.
Is Terry there or Mike Elam? Who's running the meeting?
Terry is the chair. Mike Elam is also present.
I'd like to make a motion if I have the floor. I can't tell who's ever talking. I don't even know who's talking because they don't say their name. But go ahead.
Right now,
or someone talking.
okay. Right now, you are the one with the floor.
Oh, okay. Terry, I'd like to make a motion that we put a sunshine clause on this, and we can always revisit it. But I take June 30th of this year, and if we got to revisit it, we will. But let's have a date that eliminates this ordinance.
Do I have a second for Mr. Brazel's bill? Amendment.
Second.
Okay. All those in favor say aye.
Can we have discussion on that before we?
Let's have a discussion before we vote. Yes.
Yeah. So.
I understood exactly what his motion consisted of. Maybe you could restate it for me.
Mr. Chairman, if I could, I think Councilman Brazel talked about a sunshine, is I believe the word.
Yes.
Sunset.
We're talking about sunset. I just want to make sure the record indicates that.
Okay, thank you, because that was my confusion there.
Mr. Watson, on his way.
Can you put the speaker up?
What
It's on the
I'm
bottom.
trying to say is let's put a sunshine on it, however you word it, that this ordinance would be eliminated at June 30th. However, if we need to revisit it, you know, if things are so problematic, then we can always extend the date. But at this point, I'm saying that June 30th is a reasonable date. That's what my motion would be, however you suggest that we word it.
Councilman Brazel, I think everybody understands that now, and I believe we've had your motion and a second, and we're at the discussion. I'll turn it back to the chairman.
Okay. Discussion.
I think this should remain in effect for so long as the emergency order is necessary, and that's declared by
Who's
the...
speaking right now?
This is Nancy Schneider
I'm sorry.
speaking.
Hi, Joe.
Okay, can you guys say your names, please?
Oh,
before
yeah,
you
I'm sorry.
speak, so
This
I
is
know who's
Nancy.
talking?
Okay.
Thank you.
So this remains in effect until the emergency is terminated by order of the person who makes the order in the first place, which is the county executive. I think putting some sort of an arbitrary date on it is not necessary. I think as long as the emergency is in effect, then the penalty should be in effect as well. I think the council could make a motion or file a bill to terminate this at some point if it became necessary. But again, I think we need to listen to the county executive and keep this in place for so long as there is an emergency.
The only reason, Nancy, I would suggest we do this is we have a little more grasp of what's going on, and it's not just, we got to have some checks and balances. That's the reason I would suggest this.
Yeah, I understand that, but we're getting updates on an almost daily basis in terms of, what's the progress of the situation in the county.
So point of clarification.
Mike Elam speaking.
Mike Elam speaking, Joe. I know you couldn't recognize my voice.
Well, he's got the voice. I always know that.
There you go. So point of clarification. And Ms. Jennings can help me out with this, I'm sure. So the way that I'm reading this is you are in violation of this if you are in a group of 11 or more in a non-business or family environment, basically. Social, entertainment, what's the other one that we put in there? Recreational. So if you're in one of those environments, it puts you in violation of this. Is that correct?
Well, it's just like speeding. If you don't get caught.
When you guys pass it, you should all be arrested.
Hang on, I just want to hear a clarification from our attorneys, please.
This is Amanda Jennings. Yes, one of the orders by our public health director and by the county exec is that there shall be no social recreational gatherings of over 10. Now, as Councilmember Schneider stated, police aren't going to come to your house because you have 11 people and start arresting people. This is just a tool, again, to keep people safe, people not dispersing. I was in a meeting with all the police chiefs of the county and all the municipalities, and this is something that they wanted. They wanted a tool for their police officers to use. They wanted it centralized, so instead of having to go to each municipality, if you get caught in O'Fallon breaking quarantine, the O'Fallon PD would write, to their court. This is centralized. The county is in control of it. We can be consistent throughout the county on how we handle these matters. And the orders right now that are out there are an order of quarantine. So this is a person that's refusing to stay within their house after being ordered. These are the people who have the virus or a very high risk of having the virus. These are bars and...
So Amanda, are you telling me that if there's a construction site going on and there's more than 10 people on it building a building, that's a violation?
No.
No. Because that is not a social recreational gathering.
There's another component of this is John Watson. Clearly this requires notice to folks in terms of they would have to be put on notice if they were in a situation where they were in violation of the order. At a practical matter, what would happen and what we have communicated in law enforcement is that law enforcement would provide notice at that point in time that they're in violation of the ordinance, and people at that point, if they, upon getting that notice, dispersed or whatever the case may be that they'd be in violation of, there would not be a summons issued or anything else. Because we do believe that people have an opportunity to get notice of this in that situation.
John, you like a notice, John, like you say notice, like a police officer or whoever would come and say, okay, you guys have to disperse. And what's the notice? Like a 5-minute, 10, 20-minute, a day? How does that work?
Councilman, I think that the notice would be, here's here is the law that we're operating under at this point. I want to make you aware of that, and I want to give you the opportunity to get in compliance with that law. I think the officer would make that judgment about how best to accomplish that.
If I may, John, this is Amanda Jennings again. The person will receive a summons. Right now, officers aren't arresting for misdemeanors, so they're not taken straight to jail. They're not being held. They're being written a summons where then they can appear in court and make their case to the judge.
Amanda, again, though,
John, are other communities doing this? Is there anybody else in large counties doing this sort of thing?
Yes.
Okay, Mr. Chairman.
Like around here?
Steve Alman talking.
You're going to
Chairman.
take that over now.
Yeah. Let me ask John some questions, or Amanda, either one. If we do nothing, all of this that's in this ordinance will happen. It's just dependent upon Tim to prosecute. Isn't that correct?
Correct.
So if we do nothing, all these concerns are still there because they're in state law.
Correct.
And to change it or to modify it in any way, the legislature would have to act.
Correct.
What we're doing here is basically like we did, when we created the municipal court. We took a lot of the state statutes and just rewrote them and put them into our ordinance so that we could charge the same charge and deal with it at our municipal court rather than force the people to come downtown and find a place to park and go to the circuit court, which most of the time has more important things to deal with other than traffic tickets. What we are doing here is the same thing. If you don't like this, and there's reasons to not like it, by not passing this, you're not going to keep these things from happening because they can happen now under state law across the street. We're simply saying, rather than deal with and force our prosecutor, who has more important usual things to deal with, we've agreed to take these into Amanda's office, all right, and let her deal with them. She can only do a $1,000 fine. He could do a $2,000 fine. I spoke yesterday at a press conference, and I tried to give some good news for a change. And the good news is that we have, Dimitri, help me, was it 39 people on mandatory quarantine and another 120 on voluntary?
212 on voluntary, 39 on high risk.
And every single one of those has cooperated. Okay? But one guy, one person, we were a little bit concerned, but even that person, with a little discussion, appreciation of the situation, has complied. Okay? That's what I was making the point yesterday. We can do these emergency orders and everything, but the people have to buy into this and have to cooperate because we don't have enough police officers to go and start arresting people if we have massive disobedience to these types of things. We don't have massive disobedience. At this point, we don't have any disobedience. Okay? But again, when people say, well, if I don't do what you tell me, what's the penalty? Well, the only penalty right now is to be prosecuted under the state law by the prosecuting attorney. And we would like to tell them there's another option here. It's a little less severe. We could prosecute you under our county ordinance. In a way, again, this is about where's the best way to deal with or the best place to deal with something like this, out at our municipal court or at the circuit court. Now, do you disagree with anything I said, John?
I think that's exactly right.
Okay, all right.
Mr. Elam would like to speak.
So, work with me, I'm slow. So the way I understand what you just said is whether or not we did this or not, we could not pass this at all, completely vote it down, ignore it. It's still in effect at a statewide level, and the penalties would just be higher from a state level than they would be at municipal level, but it's already in effect right now. That's what I'm understanding is point one, correct?
Correct.
All right. So the only benefit to the citizens of St. Charles County for us passing a version of this is we can charge you less than what the state can charge you. Is that correctly understanding what's going on here?
I think it's correct in that regard. I think it also, the residents, the citizens would have the ability to dispose of this matter in municipal court, which often is much easier for people to do that.
Okay.
Just as a practical matter, not a
But
legal.
from a law enforcement perspective, not a fine perspective, but a law enforcement perspective, this is all already in place. The police can come, give you a warning, give you a summons now, anywhere in the state of Missouri. Is that correct?
Correct.
Cool. Because here's my big worry, all right? Here's the thing that is bothering me at the moment. And I go back and forth between we need to be responsible and you need to try and watch over the welfare and the safety of your citizens. I believe in that. But for the last 8-9 years, St. Charles County has been voted the healthiest county in the state of Missouri. And the county executive has said on a number of occasions when this comes up, we're not the healthiest county in the state of Missouri because our health department makes it so, even though they do a fantastic job. We are the healthiest county in the state of Missouri because the citizens of St. Charles County, when faced with making a healthy or unhealthy choice, more times than not, compared to the rest of the state, our citizens make a healthy choice. Going back to the county executive's earlier point of when we ask people, please self-quarantine, they self-quarantine voluntarily. We did not have to force them to do it from a law enforcement perspective. My worry about this and things like this is right now people are really on edge and they're really freaking out about what to do. My wife's hair salon just closed today because she didn't know what's going on. There's a lot of people who are commission people and they're freaking out because they don't have a salary position, they don't have an hourly position, they don't know if their income's going to be protected or not. I talk to a lot of people who own family restaurants. They're freaking out right now because we just shut down all the restaurants and they're not used to doing carry out and delivery. And we're talking about 25 to 30% of family-owned non-chain restaurants that could very well shut down over this time. My worry is people don't know, I think, based on the folks who are outside and the comments that they've been making, people don't know that this is already in effect statewide. People in our county think we are doing this, and it's not already having a penalty associated with it. Am I clear on that? Do people understand what I'm saying? I know what I mean, but I don't know if you understand what I'm saying, so I'm just looking for a yes or no.
I think what you're saying, Mike, is we don't need to pass this because it's going to make us look like the bad guys when it's already in effect.
And I think an added point to that, Joe, is I think it adds to the concern that people have, because you're already hearing people say, well, they're going to do martial law. We're not going to be allowed in the streets. I don't think anyone here, I know anyone here, does not have that on their mind, and that's not where we're headed. But I'm worried about the message that people of the county are going to hear, and that's really my big concern. And I don't think it really matters if we put a sunset clause in this or not. If it's a statewide thing, we're basically just following what the state is doing. We're just giving them a chance to pay the fine locally, which, hey, it's convenient for you to pay a fine. And I understand what you're saying, Amanda, in terms of we have good people and they make good calls, and our law enforcement officials are not going to start walking out and looking for people, meeting in groups of 11, and hauling you into court. That's not what this is about, and it's really about putting some teeth behind an ordinance and letting people know, look, it's important, you need to take it seriously, and you need to protect your health. I get all that. I just fear that the message, us sending this as a county council, doesn't help subside some of the worry. It makes people even more on edge than what they currently are, and that's my opinion.
Mr. Chairman,
Yes.
I think those are all good points. One important distinction here when your example about being the healthiest county.
Right.
Okay. And again, yeah, I've said that several times. We're not perfect, but we tend to make better decisions as a group on things that could lead to alcoholism or drug abuse or various other problems. But when we don't make an intelligent decision about use of alcohol or drugs, okay. Unfortunately, in some cases, that affects everybody else because you may go out drive under the influence and kill someone.
Fair enough.
But generally, it just affects you. What we're dealing with here is someone who makes a bad decision. It's not just going to affect them. It's going to affect everybody who they come into contact with. So that's everything you said is true, but I think it's a unique situation, and that's probably what most people really aren't still understanding here. They want to talk about, their personal freedom to do this or do that, and I'm all for it, as long as the only person damaged is them. But that's not true with a disease. When they decide to ignore the 10-person limit, or they decide to ignore Dimitri's directive to stay quarantined inside, they put everybody else that they come into contact with at risk. Now, you're in the communications business or know the communications business, and that's been the biggest challenge the last 2 weeks, getting all this information out there.
Right.
And the media. I mean, we had a press conference yesterday with Jefferson and Franklin County, because for some reason the media thinks that the only people in the region live in St. Louis City and County. All right, that's what they cover, right. And it's mainly because they can go right down the street to those places and get the story. We pointed out to them that half the people in this region do not live in St. Louis City and County. They live elsewhere. Those in Illinois are not really part of the discussion because those decisions over there have all been made on a statewide level, so they're consistent. We have had very little action on a statewide level here, so it comes down to each individual jurisdiction. And it's been very, very difficult to communicate all these things. I mean, I wish everybody was required listening what John's been explaining to you, okay? But it's just very difficult to get the message through. And you have people relying upon other sources of information, some of which are very, very accurate, and some of which are not accurate at all. So I understand your concern about sending messages, but I think your example is different, is not on point, because this is a really unique situation. And again, it's tough.
I got a question. Amanda, could you, one of the things that...
This is Terry Hollander.
One of the things that you mentioned earlier was that this was in part initiated by our police departments around the particular county, because it would kind of unify each one of them in their response. Now, we also know that it's in violation of state law also, but could you kind of reiterate what you were saying before, how the police departments, if they were working under the same guidelines, this would be helpful?
Sure. So the order comes from Demetrius as our public health director. So it's coming from the county, and the officers, at this meeting, they're worried what to do, how to respond. They're trying to figure out all the answers to the questions. One thing they were concerned about is, how do we do this? Who do we write to? And it just came up in the meeting. What if we just had one place where all of these go? And so, as the county counselor's office, as the county prosecutors for the municipal court, it's an easy spot to put it all in here. I have access to the orders. It's easier for Demetrius to give us all that information right up front. And it's just an easier process for everybody. So it's saving everybody some steps. And I know law enforcement needs our support right now. They got a tough job to do. So this really was to help not only the citizens out there, it's easier in municipal court, but also just law enforcement, the public health department, to have one central place where all of these go.
Mr. Chairman?
Thank you.
Can I just,
Yes,
Joe and John, this is Joanne Lycum. So I want to distinguish out two things for you. One is, so let's take a hypothetical where the public health department has had to advise somebody or demand somebody be in quarantine. And the person decides they are not going to comply. And they are observed, going into society, going about, and at that point, the order that the public health director has given them that they are in quarantine is an administrative order. And administrative orders, in order for the police to act on them, have to be enforced by a judge. So right now the circuit court is standing by. They know that that's a possibility that they may have to hear those cases. Either way, the county counselor's office will handle those. Those are enforcement of an administrative order. So I don't want you to think those are going to switch to Tim's office. What additionally is going on here is that we have some people who just don't believe that this virus really exists and that this is all silliness. And they're not going to get sick anyway. And so what the tool is that this is really giving is exactly what Amanda just described, is that the police have asked that there be one place that all of this goes. Now, Tim's willing, but if Tim does it, it's an A-level misdemeanor, and it goes on their record. If Amanda does it through this, while it's called a misdemeanor, it in fact is an infraction. And it is not something that permanently goes on their record. In the sense, I guess it is, but it's going to show as an infraction. So we thought this was a better way to go. It's not putting a burden on Tim's office. If you disagree with that, I understand why, but I just want you to be completely clear about what would change, what wouldn't change, and what the decision is that you're making.
Mr. Chairman?
Yes.
Yeah,
County Executive.
Amanda.
Amanda, I'm not going to ask you to tell them how many hours you put in this week,
Steve Elman is.
because I've seen you out there. You've got plenty to do, don't you?
Yes, sir.
You've
I
got
have
plenty to do, all right? This is going to make your life a whole lot more difficult, as well as the people who work for you in the whole court process, correct?
Yes, sir.
But yet you think that you're willing to accept that additional work because not only is it going to be fairer, it's going to be easier for the people, and hopefully we won't have to charge anybody with this, right?
I agree.
But if they do, you're willing to take the work, and we're willing to have our people in this building handle it as opposed to the people across the street who have to deal with felonies and serious misdemeanors.
Yes, we are trying to lessen the load of the Department of Health, law enforcement officers, and the state prosecuting attorney, Tim Lomar.
Thank you.
Yeah, Mr. Hammond.
I don't have a problem with this bill. This is Dave Hammond. I don't have a problem with this bill, but I don't have a problem putting a sunset date on it either, especially that far out, June. It's always something we can come back and visit and extend it. But I'd rather do it at this point than wait till June or some other date later on to rescind it.
Mr. Brazel.
Yeah, Terry, there's a motion on the floor, so let's get the motion over with. It was put a sunshine date on this for June 30th, and there was a second, so are we ready to vote on the motion?
I believe so. Is there any other comment before we vote on the sunset provision that has been added?
Just so I'm clear, if we vote on this sunset provision being added to this, is that voting to approve an amended bill? Or is this just adding the sunset provision to the bill?
We're just voting on.
Just adding the sunset provision.
Just the sunset provision for now, Mike, and then we'll vote on the bill.
Okay, just wanted to be clear.
That's correct.
Thank you.
Okay, any other discussion before we vote? Okay. All those in favor of the amendment to provide a sunset on this particular bill of June 30th, say aye.
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 Opposed?
Nay.
Do we need a roll call on the amendment?
Nancy Schneider was the only opposition.
Okay.
So it's 5-1.
So it's approved.
Is it approved?
Yes, it was. Yes, it did. John, yes.
Mr. Watson, we are handling this appropriately with the voice vote on the amendment, correct?
Bob Fleck makes a good point. With the electronic participation, we need to roll call it.
Okay, let's roll call this because of the, thank you.
Councilman Cronin? Councilman Brazel?
Yes on the motion.
Councilman Elam?
Yes.
Councilman Hollander?
Yes.
Councilman Hammond?
Yes.
Councilwoman Schneider?
No.
Councilman White?
Yeah.
Okay. Okay. That has been added to the bill. Will there be any further discussion of the actual bill number 4829 itself? I might just make one comment here. Mr. Elam mentioned the fact that, sometimes, the county would maybe appear to be the bad guy in this. But in reality, what we're really trying to do is to pick out those situations, especially where someone violates a quarantine, to concentrate on those. I know that there are other provisions in here, and I know everyone looks at a worst-case scenario of policemen trying to break up a group of 11 people, but I think in reality, we all know that that's not exactly, that's not what this bill is all about at all. So I just wanted to point that out.
Can
Yes.
I just make one point about, if this bill was about somebody breaking quarantine and that's it, and we said that, I'm all on board. I just feel like if this is already in effect for state, I don't see a reason why we need to go back and add. I understand all your points, and I understand it's an infraction as opposed to perhaps if I had gone to law school, that would mean a whole lot more to me than it did right now. But I'm a corporate communications major, so we're just lucky I got paper to begin with. So I don't quite understand all the technicalities. It's going to be different. I guarantee you the majority of people are not going to understand that either. I appreciate the fact of clarification today, and I echo the county executive's message that communication is the biggest issue that we're facing right now. And I guarantee you the majority of the citizens of the state of Missouri do not understand that this is in effect for the state of Missouri as we sit right now. I want that to be crystal clear, that if I'm being told by our legal team that this is in effect statewide now, that what we did here is just basically minimizing the overall penalty, that it's already there. Am I understanding that correctly?
Yep, orders to disperse, endangering others, they're all in state statute.
There you go.
Yeah. One final thing. I truly believe that we need to allow our police departments in St. Charles County the ability and the freedom to do these things. And we know that they are there by state law, but by us reinforcing them, I think that gives them maybe a little bit more of a peace of mind, or maybe a little bit more legal footwork, if that's the term. So,
Mr. Chairman, you're not wrong. I mean, everybody's afraid, and everybody has reason. And I'm sorry, Joe, it's Joanne. I will tell you, as we've met with people continuously for the last 2 weeks, EMS workers are very worried about shortages, but they're used to doffing and donning protective measures. We have policemen who don't necessarily have large quantities of that stuff. And we've had police in the county police department, and I'm sure there's others in our municipal, who stepped forward and said, if somebody has to go, I'll go. They're worried about their families at home. They may not want to go back home if they're exposed, but we're making arrangements for all of those things and trying to make sure that we always, through the public health department, educate people who have questions or are resistant to what's going on about why we're doing it, about what the numbers look like, and about what the concerns are.
Thank you. Any other comment? Okay, I believe we need to take a roll. Yes, Mr. White.
Joanne was talking about hypotheticals. That's kind of a far reach. Just imagine St. Charles County.
Sorry. I guess.
Johnny, you still there?
Uh-oh.
Yes.
St. Charles County was a spring break destination, and we have hundreds of people that are throwing hair to the wind and practicing total civil disobedience. This would solve that problem. I'm not saying that would happen, but there could be some people that don't take this seriously and throw caution to the wind, and this would definitely help curb that. So I'm for this situation, for this, and I think it's needed. Reasonable people will find this reasonable.
Mr. Chairman.
Thank you, Mr. White. Yes.
Mr. Chairman, yeah, this is Steve. This is Steve Ellman. Last thing I want to say, and I'm glad we've had this discussion, and we would have eventually, I think, gotten to this. The thing that people don't understand is what we've been doing so far has been very difficult. Okay. What's going to become even more difficult is if we get vast numbers of people that need to be quarantined. Okay, and we pray we don't come to that. Again, I don't know. I went out last night and drove around the eastern part of the county just to see if any, since this was the last night that bars could be open, I was just curious to see if we'd had a bunch of big parties with people violating the 50 person rule, and there was none of that. Most bars had 2 or 3 people, and the most I saw was 20 or 30. But if we'd had a big party somewhere with hundreds of 100 people and a lot of them young kids, I mean, we would have had to do something about it. And again, what we can do is only administrative. We actually had a judge on. We warned a judge. We may have to come and ask you for an enforcement order last night. We didn't have to, and that's great. And that's why it's important, and it's what I've emphasized on every conversation I've had with other regional leaders and the healthcare community and all the people we've been talking to, is it's important we don't get too far ahead. We need to lead public opinion, but we don't need to get so far ahead of it. And we need to, at each stage here, we need to get buy-in, okay? And my point yesterday is I think so far we have. Yeah, you're always going to have some people disagree. You're never going to please everybody. But it's going to become even more important when we get to this quarantine stage. And that's when we're just not going to be able to tolerate people who are infected walking into a grocery store. Okay? And that's why we need this tool. Hope we never have to use it. But that's why we're asking you to consider it.
And I do want to add that if we have put somebody in that position, we'll make sure we get groceries and medicine to them. We have mechanisms in place for that as well.
Mr. Rand? Okay. All right, I believe it's time for a roll call vote on emergency bill number 4829.
Amended emergency bill number 4829, an emergency health ordinance with a penalty provision enacting a new section 210.005 of the ordinances of St. Charles County, Missouri, relating to failure to comply with public health emergency orders. Councilmember Brazel?
No.
Councilmember Elam?
No.
Councilmember Hammond?
Yes.
Councilmember Hollander?
Yes.
Councilmember Schneider?
Yes.
Councilmember White?
Yes.
Councilmember Cronin.
Okay. Emergency Bill number 4829 passes. Next up is Emergency Bill number 4830.
Emergency, yes, Joe?
I'm yes on the other three. I have to take a conference call right now.
All right, so
Okay.
you're exiting the meeting?
I have to. I got some other stuff going on right now.
All right, thank you.
All right, thank you, bye.
Emergency Bill number 4830, requested by Steve Ellman and Samantha Shadrock, sponsored by Terry Hollander. An emergency ordinance establishing leave policies regarding the declared public health emergency related to the COVID-19 pandemic and authorizing the county executive to modify the policy as needed to respond to changing conditions.
Any questions or comments on this particular bill? Seeing none, please call the roll.
Emergency Bill number 4830, an emergency ordinance establishing leave policies regarding the declared public health emergency related to the COVID-19 pandemic and authorizing the county executive to modify the policy as needed to respond to changing conditions. Councilmember Elam?
Yes.
Councilmember Hammond?
Yes.
Councilmember Hollander?
Yes.
Councilmember Schneider?
Yes.
Councilmember White? Yes. Councilmember Cronin? Councilmember Brazel?
Okay, Emergency Bill number 4830 passes. Yes.
Ask John a question.
Well, it's too late now. We already passed it. I'm just kidding.
No, my question is, do we have to publish this as a criminal ordinance?
The previous,
Bob, Bob may know. Do we have to,
Which ordinance, Steve?
the one we just passed?
4829.
29, you mean?
as adopted, it goes.
No, I'm sorry, yeah, not the leave policy, the one before that.
Okay.
Right.
If it's a criminal statute, do we have to?
I think as adopted, it goes into effect. With 4 votes, it goes into effect with your signature.
Okay, no requirement that because when we did the municipal court, I thought we had to publish.
Right, generally you have a charter this is Bob Hoink here. Generally, you have a charter requirement that an ordinance with a penalty provision has to be published. It has to wait 30 days to go into effect. I would suggest that that is essentially waived in the emergency situation. We're also operating under the adoption of a charter.
Good.
Except in an emergency.
All right.
And Rory concurs, so we're all good. Sorry, man, I just couldn't resist.
Thank you. Next up is Emergency Bill number 4831.
Emergency Bill number 4831, requested by Steve Ellman, sponsored by Terry Hollander. An emergency ordinance authorizing the county executive or his designee to execute a memorandum of understanding between the St. Charles County Department of Corrections and various agencies for the purposes of coordinating effective response to handling incarcerated persons within St. Charles County during the COVID-19 pandemic.
Questions or comments on Bill number 4831? Seeing none, please call the roll.
Emergency Bill number 4831, an emergency ordinance authorizing the county executive or his designee to execute memorandum of understanding between the St. Charles County Department of Corrections and various agencies for the purposes of coordinating effective response to handling the incarcerated persons within St. Charles County during the COVID-19 pandemic. Councilmember Hammond?
Yes.
Councilmember Hollander?
Yes.
Councilmember Schneider?
Yes.
Councilmember White?
Yes.
Councilmember Cronin? Councilmember Brazel? Councilmember Elam?
Yes.
Okay. Emergency Bill number 4831 passes. Okay. Those conclude the bills that are on the docket for today. Before we adjourn, are there any other comments by any of the council?
Can we maybe get some, I'm sorry.
I thought you wanted to hear from Dimitri.
You had said that you wanted to hear from the Director of Public
That-
Health, that's why we pulled him out of all the work agreement.
That would be
Thanks for
very-
playing. That's what I was
Yes,
just about to ask.
Yes.
And for the record, is your first name Dimitri or Demetrius?
It's Demetrius, according to my mother, and everybody else calls me Dimitri.
Thank you for the clarification. I've heard you called both, and I didn't want to be disrespectful, so.
I still write Demetrius because she smacks me in the back of the head if I don't. So.
I feel your pain. Thanks for being here, and thanks for doing the update, and thanks for all you've been doing. I know you haven't been getting a lot of rest, and I appreciate you and your entire department for all that you guys have been doing.
Thank you. I will pass that along. Let me just tell you where we're at, and I'll go through everything, and I'll stand for questions when you have them. The EOC has been fully activated for a while now. We have 39 people under ordered quarantine, 212 people under a voluntary quarantine. 6 of those people were a business exposure. There are currently 22 medium-risk states, so this is community spread, moderate community spread within those states. Our hotline is pretty active. We're averaging about 100 calls a day, and that has a lot of variability depending on what's happening in the news cycle. Our testing criteria is still very strict, as established by the CDC. So we have only been able to test 14 people. We've tested 14 people. We have 2 still pending. And the positive case here in St. Charles County came from a private lab. I don't know how many private tests have been sent. They're not reported unless they're positive. Some of the major concerns that we're hearing is lack of access to widespread testing. We know that there is community spread, but we can't identify it. For us, it's akin to trying to tackle a monster that is in the dark. Lack of personal protective equipment for everyone, anybody at the front lines of this. There are currently 254,701 cases in the United States. There have been 10,000, in the world, there have been 10,447 deaths, and 89,000 people have recovered. That's a 4% death rate. And to put this in local perspective, if 1% of St. Charles County got this disease, you can anticipate 160 deaths and 800 hospitalizations. That's if 1% of the population of St. Charles County gets this disease. And you can extrapolate further. Italy has had 41,000 cases and 3,400 deaths. They're now the country that leads in deaths. There have been 442 identified cases in Illinois, and it's expected that there is widespread of the disease, and that we can't identify it because there isn't widespread testing. So there was a story on NPR this morning where a woman shared how she infected her friends. She had a lunch date with friends. They didn't touch. They knew that coronavirus was out there. On that particular day, she felt great. She had no symptoms. All they did was have lunch. They didn't touch each other's plates. They didn't touch each other. She infected 4 friends from that lunch date. This disease is very contagious, and it has mild symptoms for many people. We thought only the vulnerable were going to be hospitalized, but we're now seeing that about a quarter of hospitalizations are 20 to 44-year-olds. I can't give you predictions of what's going to happen, but I can tell you that what's in front of us is extremely serious. And I appreciate any effort that you take to protect our citizens, because this is here. What questions do you have for me?
So a couple of questions. First of all, those private tests, is that like LabCorp?
Yes.
That are doing those tests? So we have no way of knowing how many of those tests have been or will be administered? Is that what I'm understanding?
They're not reported, yeah. There wasn't an emergency clause to make this a reportable disease, and positive tests have to be reported to local public health authorities, but negative tests do not. So I do not know how many of those tests have been done.
Okay. And procedures that we're asking people to follow if they show any type of symptoms is call their medical professional, and the medical professional will make arrangements for them to be tested. Is that what I'm understanding?
That's correct. If anybody develops symptoms, and the most common symptoms are fever, a dry cough, shortness of breath, myalgia and malaise, so weakness and general achiness. Those symptoms, if they present, a person should isolate themselves even from their families and call their provider to make arrangements for testing.
And sorry to monopolize the conversation here, but so your numbers for 1% of the county getting infected are pretty scary, which makes me wonder, do we have an idea of how many hospital beds we have available for use in the county?
Not enough.
That's fair to say. I know there's only 4 hospitals, and I don't think any of them have capacity of over 100 rooms, do they? Maybe St. Joe's. But that would be about it, I think. Do we have, or have there been conversations with other entities to make arrangements in the, no, okay.
Everybody needs those beds. It's not just here. But I will say that SSM, BJC, St. Luke's, Mercy are in constant daily conversation right now, not only with each other, but with the county executives.
Right.
But
It
with
works
the
better
county
if you turn it on.
executives as well, sorry.
Okay.
I'm missing out on that conversation right now because I thought it was more important that I hear from you all.
I appreciate that. I guess the only other question that I had is, our restaurant closures that we have right now, making everything carry out and delivery, is that just like the 4829 that we had? Is that a state instituted policy?
No, I think you can go to one county, go to Warren or Lincoln County and go to a restaurant, I think.
So making the restaurants non-sit-down, carry out and delivery only, that's a St. Charles County call, not a state call, is that correct?
That's
And
correct.
we were, basically, St. Louis, we had some serious questions about it. We were not really convinced, although we were getting there. But what kind of, in the end, convinced me, and we had this discussion, if all their restaurants had closed,
Right.
what we would have had is a whole lot of people crossing the river to go to our restaurants, which normally we would have applauded as an economic development tool, right? But what we would have had is a lot of affected people basically coming to our county. And I assume there's a certain number of people going to other counties that are infected. So, it's an individual decision, but what other people do, what other jurisdictions do, definitely have an impact on us. And having made that decision, I'm convinced now that it was the right one to make.
So I would ask if we could consider what I believe Texas is doing, and that is they're allowing package carry-out liquor and beer to go along with the food sales. So you could do carry-out alcohol as well to do something like that. I don't know what the restrictions are of that. I don't know what the legal ramifications are, and if that's even possible, but I'd like to consider it if possible.
We've had this discussion, and we're very much aware of this issue because of all the discussions been going on the last couple of years on Main Street, right down the hill. Okay, and when all that was going on, I asked our people to research what can we do if the city didn't do something or if we wanted to do something differently. Fact of the matter is, people have to get a county liquor license, and it's revenue for us, but we have absolutely no regulatory authority. The state liquor control or the municipality can control that, and that's something that they perhaps should look at. But we can't. Bob, you did all the research on that.
Bob Hoink here. Even more importantly, I'm getting calls. I represent finance in the registrar's office, and they're inundated with calls from restaurants wanting to know if somebody comes in, there's only 10 people can be in the restaurant, they're picking up their meal, can they get liquor to go with the meal? And the answer is yes. We've also answered the question, can I sit down at the bar and have a beer while I'm waiting? And the answer is no. So that's how it's being applied as of yesterday.
So if I'm understanding what you just said, they could get liquor to go home with them as part of their order?
Correct.
Great, because I don't think a number of restaurants know that. And just as a side note, for anybody who's bothering to tune into this or is going to watch it later, I would say if you have a sit-down restaurant that is your favorite and they're not used to doing carry-out and delivery as part of their regular everyday stuff, you should champion that place and do carry out and delivery as much as you possibly can to keep them around, because I understand the health aspect. I'm also concerned about an economic prospect and losing 25 to 30% of our family-owned restaurants. So if you can help keep them in business, that's great. And a lot of them make good profit off of carry-out alcohol or off of alcohol sales. So if they can do a carry-out bottle of wine or a six-pack of beer with their order, I think that may help them, as long as it's legal to do that. I don't want to get myself in trouble.
That was what I was going to say. If they have a package license under state law, then they can do that.
Can they?
And the, I'm sorry.
Can they get a package license, or can we talk to the state about allowing that carry-out alcohol during this? I know we have talked to state people on a regular basis, but can we maybe ask for a waiver from the Liquor Commission?
I don't know if you could get a waiver. I'm not familiar enough with how the state's operating under the circumstances with the liquor laws. But I'm sure it's something that could be requested.
And this just in.
Hey, Mike, I know the president of the Missouri Restaurant Association's a former student of mine. I'll call him when we get finished here. Make sure that what Bob said, make sure they're aware of that. I'm sure they probably are, and they've probably notified their members.
I appreciate it.
I'll find out.
When, John Watson, Governor Parson issued Executive Order 20-04 on Wednesday. It allowed all state departments to waive not only their regs, but also statutes to deal with the pandemic. And so the question is going to be, and I suspect all of these things are going to be, there'll be a lot of people requesting those waivers for different reasons. And so the question is going to become if the Department of Public Safety would grant such a waiver under that executive order for this purpose.
Cool.
But I think that, in my view, I think they could, because the executive order is very broad delegation of the ability for departments to waive.
Thank you. Sorry.
Since if we hit a spike in this virus and we don't have enough hospital beds, do we have a plan in place to have a makeshift hospital location?
So all three executives for BJC, Mercy, and SSM have been in regular communication with each other, and they are trying to address this issue. They've been working very well together, I must say, and the public health side of health is appreciative of their efforts, but we are expecting to not have sufficient hospital beds. And that while they're exploring every possible option for makeshift hospital beds, we are not expecting to have sufficient hospital beds. So whatever we can do to dampen the curve and prevent the spread of this matters. If we have widespread infection in our community, we don't have the capacity to treat everyone.
Any other questions?
Is there anything else you feel that we need to know that we don't right now?
I think you really need to...
Mr. White.
There was a constituent in my district that operates a licensed daycare, and they were concerned that, but they don't know where they stand right now. What is the stance on daycare as far as forcing them to close?
I have gotten calls from several daycares asking me to close daycares so that they can access their insurance funds.
Yeah, that was the concern of this position. They were concerned on the financial aspect that if they close voluntarily, then they may not be eligible for any funds that would be coming in the future. But if they were mandated to close, then those funds possibly could come to them. Is that correct?
I can't speak to how insurance companies work, but that's my understanding. And to that, I will say there has been a lot of conversations with my colleagues and my peers throughout the state about this very issue. Our concern is that the frontline folks, the public health workers, the hospital nurses, the police, may need childcare, and closed daycares may prevent our first responders from addressing this pandemic.
You started to make another point, I think, before, Mr. White. Anything we need to know?
The points I really want to make to everyone is that this is an extremely contagious disease, and there are people around you who are not showing symptoms. So wash your hands, sanitize surfaces, keep safe distance. This is not to inconvenience you, and I do understand how inconvenient it is. I need a massive team to address this right now, and trying to keep them safe is a challenge when everybody else is whining about their inconvenience just because they wanted to hang out with their friends. This is my 16-year-old this morning.
Any other questions? Thank you. We certainly appreciate your efforts and the challenges that are ahead of you.
And I would just, because Dimitri and I talk about this every day, the health departments, EPIs, all their additional staff, the ambulance district, the police departments, the school districts staying in contact. I mean, the number of people who have voluntarily put themselves out there every day. But in the end, I have to especially call out the epidemiologists and staff who are working as epidemiologists, who are on the phone with these people who are scared to death, at the call center who are scared to death, and who are trying to give them good advice in a very changing world for them. You know, on Tuesday, I believe it was, CDC did not have Illinois, Michigan, a number of the other states where there was clearly community spread going on the list. They were telling people, if you've been to Illinois, you could come back late Wednesday, I think it was. Illinois went on the list, and so they had to let people know, well, they can't back all those phone calls. They can't, at the hundreds of calls they're getting every day. But then they did have to, you know, go and apply it to whatever else they were doing. So it's just, there's been some communication issues. I mean, very much to Councilman Elam's, we're trying as hard as we can to stay on top of those. Mary Enger has done yeoman's work with her staff to try to stay ahead of this. So I just want you to know, nobody's taking it anything other than incredibly seriously.
So to that point of communication, where should we direct people as our best possible point of information for St. Charles County? Would that be the county health department website, or?
Yeah, citizens should either go to our website for information or a reputable website such as the CDC or the Missouri Department of Health and Senior Services. And we have an 800 number that people should use. It's 639-949-1899. And any of their COVID concerns can be addressed through that call center.
And they can find that number on our website?
Yes.
Okay, so that's on the health department website.
Yes.
I would make a request, and I know you guys are swamped with all kinds of stuff, but I went to the county website yesterday to watch the county executive's press conference, and we didn't have a link that I found on the county website, but Donna was nice enough to send me that it was a Facebook Live that we carried, so I appreciate carrying the Facebook Live, but could we put maybe a link on our county site to get people there? So when we do have something like that, to make it as easy as possible for people to link to our Facebook page, to watch a Facebook Live, or something to that matter. Anything we can do to make it as easy as possible and make our homepage the central point of contact, or make our Department of Health page the central point of contact to find this information and link off of that?
Yeah, sccmo.org. /COVID, COVID.
And if you go to the homepage at sccmo.org, you'll see the COVID-19 little icon on there. You can just click on that, and that'll take you to the page. So if you go to the homepage, it's right in the middle of the page. You click on that, it'll take you right there. And if you click on the little icon twice, actually, you go let it open the first time and then click the second time, it'll take you to the page where it shows the daily updates of how many people are quarantined, how many people have been tested, at least to the best of we know. And I appreciate you guys keeping that up to date as much as you can. I know that's a struggle. But checking there and also checking out the Missouri Department of Health and Senior Services page has a statewide number that's always running, so you can go there and find the state information as well.
And I will just mention the phone number is 636-949-1899.
There you go.
No problem. And finally, one good piece of news, perhaps the county executive could repeat to you all. He did have a conversation with Craig Schnook, which I think is very important to your ability to reassure your constituents.
Yeah, I had a conversation with Craig, I guess, 2 days ago, and we were just talking about making sure there were signs, trying to get signs up to remind people about social distancing, even in the grocery stores.
Okay.
And he asked me every opportunity I had before a crowd or before a camera to reassure people that the food chain is intact and that the supply chain is fine, and there's plenty of food now. There's going to be plenty of food, and nobody needs to panic if something isn't on a shelf today. It'll probably be there tomorrow or the next day.
Which I think is a great example or time to remind people there's no need to hoard. Stuff is coming, but the more that you hoard, the more you stop people who need those supplies for being able to access them. So take what you need, but don't overtake, because, my Lord, you're not going to go to the bathroom that much. Let's be real. Unless you have a lot of Gatorade that you're going to have there, you're going to be taking one of those hospital beds. So you're not going to need that much toilet paper. It's okay.
Anything else we should say, Joanne?
No, I think that's the most important thing, is that we have been assured that the supply chain is intact. The municipalities across the entire metropolitan area have given way on their delivery times to allow the restocking. And it's really, they've only curtailed hours at groceries because they've got to get in there and restock. They have unprecedented amount of product being moved.
Yeah.
And so they're concerned about that.
Thank you. Okay.
The only other thing I would say is that I know three of you have called me to talk about this, and I'm sure the others maybe didn't call me because they know how busy we are. But I've been home at least by 7:30 every night, and I'm a late night person. If anybody wants to call and talk about this and not be under any time constraints, call me in the evening. I'll be glad to talk to you about it.
All right. In closing, I just want to point out that in these unusual times, obviously our meetings, public meetings, are going to have to, take some adjustment. And I think this is an example with the amount of communications that we do have available. I think that we can continue to keep the public informed to the best of our abilities. And as we move forward here, I really have the greatest confidence in both our administration and our county citizens that we'll be able to meet this challenge head on. Motion to adjourn?
Motion to adjourn.
Second?
Second.
So moved. Thank you, folks.
Thank you all very much.